Hi, everyone. Welcome. Thank you so much for joining us this evening. We know how hard it can be to find time in your day, so thank you. Welcome to the webcast that we put together for the Grooming Association. You groomers are awesome, and we want to recognize that. So my name is Jenny Tate. I'm a registered veterinary technician. I'm an animal health technician, and I'm also a veterinary technician specialist in dermatology. Right now, I'm the only one in Canada, which is a tiny bit lonely, but hopefully that will change soon. And I'm joined here this evening with my very good friend, Miss Becky Valentine. Becky, you introduce yourself.
Hello, my name is Becky Valentine, as Jenny has mentioned, and I've had the pleasure of being trained by Jenny and working with Jenny for lots of my career. I'm a board certified veterinary dermatologist working in Calgary, Alberta, so the other side of the country from Jenny, but we're really excited to be able to gather groomers into our group of people that are part of this Empathy for Itch campaign. I'm going to let Jenny tell you what the Empathy for Itch campaign is about.
So the Empathy for Itch campaign was a brainchild that started, this is our 4th year, I think, already. Time flies. We must be having fun. The whole reason behind it is to educate pet parents on what is normal and what is not normal. So Becky came up with our catchphrase, itchy pet, see your vet. And truly that's the bottom line. So our first year, we connected a lot with some pet owners. Our second year, we were really driven to try and connect with the veterinary clinics all across Canada. Last year, we kind of did a combo of both of those things, with communication being our big highlight last year. And this year, we've changed our game a little bit, still all about communication. But this year, it's about how working together is better. And of course, we all know that the groomers are part of those veterinary healthcare teams. We know that you guys are quite often the ones that notice a problem and give those pet parents a little nudge to point them in the right direction. So here we are. So what did we do, Becky?
When your pet is itchy?
Yeah, itchy pet, see your vet. Oh, wait, hang on. So what do we do, Becky, when you see an itchy pet? Itchy pet, see your vet.
I've got my timing misfired.
Do you want to do it again?
Yep.
Okay. So what do we do when you see problems?
Itchy pet, see your vet.
You're going to get tired of seeing our signs. So this year, instead of us just deciding what we should be telling you folks about, we actually did a groomers survey. And one of the first things we asked on our survey was, what questions do you have for a board certified veterinary dermatologist? And we got some replies back from you guys. One of our first ones was,
what products can minimize itch and how do we prevent itch? This one, Jenny and I both have so much passion for what we do and so much passion for the Empathy for Itch campaign, but this is a big question. What minimizes itch depends on where the itch is coming from. So it's in some dogs, as an example, and Jenny, jump in anytime, what can soothe one pet's itch might be a colloidal oatmeal shampoo. And what might soothe another pet's itch might be a shampoo that's more targeted to get rid of maybe an overgrowth of a microorganism or a secondary infection because of an underlying problem. So there's multiple different soothing shampoos, multiple different ways we can care for the skin, but it always depends on what the underlying problem is. So if you have an itchy pet, see your vet.
And you're absolutely right, Becky. This is probably the question we get asked most, I would say, is why is my pet itchy? And there are a bunch of different things that it could be. So it could be you've got an infection on board. That could be bacterial or fungal, right? You can't tell by looking at it.
Exactly.
After 23 years, I still get surprised when I take my sample and go run and look under the microscope. I'm sure it's going to be bacteria, and what do you know? It's yeast, or vice versa. So you just don't know. So it could be infection, could be parasites. That's a little bit more obvious, but sometimes not. It depends on which parasite. So demodicosis, when their immune system is a little out of whack, that can look like other stuff as well. It could even be an immune-mediated disease. It could be an underlying endocrine disease like hypothyroidism. Or it could even be something as scary as a type of skin cancer. So they can all look virtually identical. And did we add allergies in there? Did I miss that?
So, and I was going to comment on when we talk about environmental allergies as an example, we talk about those dogs starting just with itchy red skin. You know, when and might be the groomer that sees that dog the first time. By the time I see it, it might have a lot of secondary changes and secondary infections. But if the groomer's seeing it as just we call it pruritus cinematera, but itch without any symptoms in the skin, and that's the primary start of an environmental allergy. Just as Jenny mentioned, one of the things that always makes us stay on our toes is, as she mentioned, cutaneous lymphoma. That can present as just itch for a very long time before we get secondary changes. Then the other thing that's interesting is where we live, because I studied with Jenny in Ontario, and I'll tell you what, out here in Alberta where I practice now, there is dry skin. And there's some dogs that just need the right shampoo and the right conditioner because it's so dry in Alberta. And I didn't ever, I didn't have it as part of my practice in Ontario. So the list of things that can make the itch happen, as Jenny and I are talking about, is as long as my arm.
Yeah. And the products that you use depends on what the cause of the itch is and how we're going to help make that skin barrier better, the pet more comfortable, all that good stuff. I had a little note that I put down here for myself, just asking to drive home. Sorry, it's freaking hot in my little house today. Just to drive home to the groomers to really try and be cognizant, really try to be aware of any topical products that animal might actually be using, because depending on what it was, you guys are fabulous at bathing, but you might be bathing off some medication that actually was meant to stay on. So I don't know if you guys have a checklist, but if you do, maybe that's just a little something to keep in mind.
Yeah, it's a good point. And not only could we wash off a topical medication, but lots of different things that owners get at home can create itch. We can end up with a shampoo that just has a little bit too much of something in it. It's a bit too drying, and we actually create itch with that. So yeah, you're right, Jenny.
Yeah, absolutely. So I think we have confirmed.
Itchy pet.
See your pet. Okie smoky. So our next question was,
what can we as groomers do to help clients with itchy skin, dandruff, and hot spots?
Aha. Well, what do you think about that one, Dr. Valentine?
What I love about a hot spot is what we know about a hot spot, right? A hot spot at the end of the day is a localized area of a superficial infection. Most of the time it's created by a staphylococcus. So the most beautiful thing is the topical shampoos we now have that reduce bacterial infection. So again, part of this question ties into, we're going to use a shampoo product that is going to help the epidermal barrier in that disease. And that's why we have to understand where the itch is coming from. But particularly with hotspots, we know it's a localized superficial bacterial infection, and we have so many beautiful shampoos now on the market that can get rid of that bacteria while hydrating the skin instead of stripping it away from its natural microflora. So I love a good hotspot.
I would add a little more nudge there, that those beautiful products work better when they're actually prescription products. There's a lot of stuff over the counter. There's a lot of like witch hazel and what have you, a tea tree oil. those can actually be quite irritating and can make things worse. So the over-the-counter products, bless them, I know the people creating them are trying to help those little beasties, but honestly, you have to know what is causing the problem and then reach for the most effective product. And you're going to get that from your family veterinarian. So
Itchy pet.
See your vet.
And Jenny makes a good point. You know, there's nothing as good. I guess where I get excited with groomers and bacterial problems specifically, of course, we have to diagnose it. I can't see a bacterial dog from a yeast dog, from a Demodex dog, from a dry dog with my eyes. But once we know what it is, the groomers are such an important part of being able to, as an example, if it's bacterial, maybe we don't have to use antibiotics and we can use these excellent, well-formulated medicated shampoos to get rid of the bacterial infections. Yeah.
Yeah. And I think as well, the groomers really come in as maybe that first set of eyes. So it seems obvious to you and I, but the earlier there's intervention, the better off that quality of life is going to be improved so much faster, the sooner everybody just gets on that bandwagon.
That's right.
Okay, our next question that came up.
What is the link between skin issues and diet? And then how to effectively deal with yeast. Now this is interesting because I have a lot of clients coming in and their research has led them to believe that diet is directly related to yeast. Now, do you want to tackle that question first or me, Jenny?
I think we can combo. I think we can both jump in here.
So, you know, the underlying allergy and whether it's food or whether it's environment it's a hard question. There's no test that's telling us that. It's the history and the presentation and what you have done with diet that actually enable you to focus on one arm of the allergic disease or the other. With yeast specifically, how I approach it is yeast likes living in inflamed skin. Now, is it a food allergy that's creating inflamed skin? Maybe. But it may not be a food allergy that's creating the inflamed skin, but the yeast loves the inflamed skin. So I don't think of, and nor do we have any evidence that direct proteins are resulting in yeast infections in dogs, but yeast infections in dogs are being created by this inflammation in the skin due to an underlying problem, and that yeast can really perpetuate the itch tremendously, let alone the alteration of the skin barrier.
Yeah, well, I don't know how many times I've had an owner say, I think it's the carbohydrates in their diet that's feeding the yeast. And I don't know where that's come from, but in veterinary medicine, at least, we don't have any shred of evidence that that's actually a cause and effect. So I completely agree with you. To have yeast overgrowth, to start a yeast infection, you've got something wrong somewhere causing just the right hospitable environment. So typically it's hot and it's moist, and that's when we run into trouble. So again, early intervention. So I'm going to do it.
Itchy pet, see your vet.
All right. Little did you know what kind of a monster you created with that. I also had a little bit of a note in here about some genetics. So my mind went to like zinc absorption problems, vitamin A responsive dermatosis, ichthyosis, those golden retrievers with those giant dandruffy scales. So we do work with those guys with diet to a certain extent as well, but again, it all goes back to what is the actual problem? What is driving that problem? And then we look at diet and see how can we help them out with that. So, yeah.
I often talk about, you know, we like to have food allergy and environmental allergy. What I do with nutrition, even if the dog is not a primary food allergic dog, nutrition can either help or harm the skin barrier. And the skin barrier, as you groomers know, it's the window to the allergy. You know, the healthier epidermal barrier we have, the less allergic the patient is. And when you see these dogs coming in with rash, that's just perpetuating the disease. So it's a happy epidermal barrier is an important part of managing any dog with allergic disease.
Yeah, absolutely. And when we think of food, we obviously think of those essential fatty acids. But a lot of foods, you have to be careful with those too, because a lot of foods now already have that supplemented in them. And if we like over supplement somebody, especially with the omega-3s, we can actually cause an inflammatory effect instead of the anti-inflammatory effect we were hoping for. So just don't chuck things at them willy-nilly. It has to be an educated response to something that you know is going on. You got to get to the root of the problem, right?
That's right.
Yeah. Do we need
Therefore,
another woof? Do we
we
need another
do.
woof woof?
Yeah. Itchy
Why not?
pet, see
See
your
your
vet.
vet. All right, here is our next one.
How to identify types of itchiness. Is it allergy? Is it food? Is it environmental? Is it parasites? Or is it genetic? So you just mentioned, Jenny, something like ichthyosis or a keratinization disease that a dog would be born with and would probably worsen over time. That question right there is a $64,000 question. And I think Jenny might have helped me with this when I was learning dermatology, but I'll often say to an owner, we're gonna take care of the itch, we're gonna take care of the epidermal barrier, we're gonna find out, where this allergy is coming from. But what allergy it is may be the last thing that I tell you, because it's very difficult and it takes multiple visits in a what am I trying to say? In a linear fashion, multiple visits to actually get to the underlying allergy sometimes. So the endocrine diseases, the parasitic diseases, thank goodness we have easy tests for those. So if the itch is from a parasite and you see your veterinarian, that can be diagnosed and dealt with. If the itch is from an endocrine disease, Jenny and I, Jenny's mentioned that we're talking about adrenal gland disease or thyroid disease, then that also has tests we can do. With allergies, it's more of a diagnostic path and getting to a diagnosis really of elimination. So ruling out all the other things that can cause itch before you get to the underlying diagnosis, maybe per se of an allergy. And then whether it's food or environment is another little road we're going down to understand whether or not the animal can be cured with an elimination diet or whether they have a seasonal component. The layers of allergy are thick. And that's probably why some of these owners that you see can be very, very frustrated with the care, and why it's not always the easiest answer what the underlying diagnosis is off of the first exam.
Yeah, they all look the same. So
all look
itchy vet. See your vet. There's a theme happening here, people. Okay, this next person says,
I'm very interested in the link between diet and skin coat health. Why do dogs get dandruff, and are there any helpful supplements? That's a good question.
Yeah.
Do you want to start with dandruff? You start.
Well, dandruff can also have many causes. You know what? Our typical answer to everybody when they ask a dermatology question is, it depends. There are many reasons to have dander. And, I came to visit my friend Becky out in Calgary, and I was shocked at how dry it is there. I had really not clued into that before. So here in Southern Ontario, it is a hot, humid day. I've got a helmet for hair. Like, man, very different. So depending where you are across the country, maybe dander is more likely caused to dry skin. But here in Southern Ontario, we're looking for something else. So lots of reasons for dander. It can be genetics, right? We can have keratinization disorders. We can have poor plane of nutrition even. We can have parasites. There's this beast called Clilatiella, also known as walking dandruff. And literally it looks like flakes of dander walking across the back of a very itchy creature. We can even have immune-mediated diseases that cause that dander to kick up as well. So, and of course, we can also see that with our skin lymphoma guys as well. So, one more time.
Itchy pet, see your vet.
Yeah, it's
Un-
not just diet. There's a bunch of
no,
different reasons, and
yeah,
they all look the same.
they do. And then sometimes there's the rare dog, but I find that sometimes when they come to the vet, they get stressed out. And you can even have a dog who has a little bit of scale just from the stress. So you groomers may see that in dogs that you find that are anxious at the groomers. So it can be something so subtle as stress to something like early lymphoma, even though it's just dandruff. Yeah.
Yeah, absolutely. All righty.
Okay, so this one is, what are the top food ingredients that cause itchiness and irritation to the skin? Another excellent question.
Yeah, this one is a loaded question.
Yes, it is. It is. So when I was learning to be a dermatologist, I think that my mentor had the top five were, and this was a research that came out of Hills in 2011, I think, and it was beef, lamb, rice, dairy, wheat. I think we used to talk about.
Chicken, I think you missed.
Well, when I was in my 20 years ago, chicken wasn't there, but now what I would say is chicken's my number one. Yeah. And
Yeah.
we know, with advancements in science, we've got some advanced diagnostics in allergology. So we know that chicken actually also likes to cross react with salmon. So chicken, salmon, beef used to be in the top five at least, and in any individual dog, you have to rule out the ingredients. So we've got chicken, beef, dairy can be a top one, wheat can be a top one.
Yeah. My own dog, it's corn.
Corn, yes, corn. And things like corn are tricky for us actually, because at the moment, and I think this will change in the next 5 to 10 years, we don't have a good test for things like corn. We don't have any tests for the food component. So while corn and soy are really common ingredients, and it makes sense that those are going to become allergens in our world, we just don't have the precise testing for that. But yeah, so it can be a protein or it can be something else in the diet.
Yeah, and I think you hit the nail on the head there, Becky. It's not the ingredients, it's the most common ingredients, which is what are definitely, if you just think about it for a sec, if that's what everybody's eating, well, that's going to be the most common allergen. It's not actually that protein, it's what they've become sensitized to.
Exactly. Yeah.
Okay, and yet another reason.
Itchy
It's
pets. See
see
your
your
vet.
That's a very tangled web to untangle when we talk
Yes.
about what food ingredients those poor
Yeah.
critters are allergic to.
Yeah. Yeah. Okay. Now we've got, how do we emphasize the urgency of a skin issue that would need to be seen by their veterinary team? And that's a tough one. I do imagine that as groomers, you probably see the same spectrum of owners that we see as veterinarians, and you have owners on different ends of the spectrum. I imagine, in fact, sometimes in those dogs that have uncontrolled skin disease, the relief comes for the owner just with the grooming. So yeah, it's you probably see that. Jenny, can you comment on that?
Ah,
When it's nudging, is it itch? Is it smell?
anything
Uh-oh.
away from today. I think it's that itchy pet, see your vet. And the reason for that is what we keep saying over and over again. Everything looks the same. It could be something like even a flea allergy. Okay. I'm sure you guys see that. Or it could be something as concerning as that lymphoma, that skin cancer, which does not have a great diagnosis. So, you could be on two spectrums where you pop a pill and you're totally fine or not. And we don't know that until they get into a veterinary clinic and, there's some logistics and some diagnostics that happen and they tease it apart. And maybe the other thing you guys can take away today is planting the seed with those pet parents like, wow, I watched this webcast and you know what? Itching can be this, or this. And it's not something that's going to be figured out in one appointment. It's probably going to take several appointments so they can rule out the scarier stuff and then tease apart the not so scary, but the lifelong management of those things. So that's my goal for today. I hope that happens.
Yeah, no, I think it's and there's lots of different owners. If an owner is frustrated and you're seeing the disease, and maybe they need to seek out a veterinarian who has a special interest in dermatology, or even find a board certified veterinary dermatologist. Their veterinarian may be trying, to the best of their capacity, but maybe it's a more serious type of skin disease. So there are lots of people who have special interest in dermatology. There's quite a few of us dermatologists across the country. So if you think the animal's suffering and we need more help, maybe they also could need a referral.
And Becky, you mentioned something about a study. I apologize. I still have not read this study, so I shouldn't be speaking to it. But I know you read a study about faster outcome and just overall happiness.
Yeah, so this was published by the American Academy of Veterinary Dermatology, and they looked at the time to relief or the time to cure for the pet with their underlying disease and the cost. And when a dermatologist was involved, the time to cure and the cost to cure were cut in half by 50%. They were reduced by 50%. So if there is a local dermatologist, we can really be helpful as great being part of the team. The team of the dermatology team, the GP team, the groomer, the pet parent, everybody working together to make sure that we can get a management strategy for this pet and this family that works to keep the dog comfortable.
Yeah, and the other thing I really wanted to make everybody aware of as well is the Empathy for Itch landing page. So the Canadian Academy of Veterinary Dermatology, over the last 4 years, we've been creating what I think is a pretty awesome landing site. There's tons of resources for veterinary clinics, but there's also a whole whack of resources there for our pet owners. So if you got nothing to do, or if you have 5 minutes after you've done this webcast, take a look. It's the Canadian Academy of Veterinary Dermatology, so CAVD.ca, and or type in empathy for itch, and you should end up there as well. So lots and lots of resources there. So hopefully that helps.
Yeah.
Okay. Our next question is quite specific.
Are there any good natural remedies for yeast? And I think we were talking about this when this question came up. I have a lot of owners who use apple cider vinegar 50-50 with water. And I would say that lots of my owners think that that works quite well to reduce yeast. And I would say if the pet tolerates it and the vinegar doesn't sting, that would all have to do with how inflamed their skin was. If their skin was very, very inflamed, vinegar may sting. But otherwise, that half vinegar, half water anecdotally seems to give some pets relief. Now, no one, interestingly enough, has done a study to say whether or not that's stripping the epidermal barrier from its natural health. Nobody's done a study to see if it really reduces counts of malassezia, which is the yeast on dogs. We do have very good antifungal shampoos. And there's one prescription shampoo in particular that is very good. I also have owners who will use Head and Shoulders or Nizoral, and that as an antifungal over-the-counter shampoo. And I would say the big difference I see with that in the veterinary is just simply in how dry the skin gets with the Nizoral or the Head and Shoulders. And if you're going to replace it with a good conditioner, then it would be less irritating. But the only difference is in how irritating it is. And the outcome of that in my hands depends on the dog and whether or not the dog's skin is really red and irritated or not. If it's not so irritated, it's a basset hound, it lives with yeast on it all the time, and it's greasy, then I find that the human antifungal shampoos don't do a bad job of getting rid of the yeast. But the veterinary prescription antifungal shampoos have moisturizing agents in them, and they do a really good job of getting rid of the yeast without stripping that epidermal micro environment down.
Yeah, and maybe the other thing we should touch on too is how to bath a dog, right? All of you groomers know how to bath a dog, but owners, if they're doing their own bathing at home in between visits to you guys, some people think a bath is filling up the bathtub with water and then you throw your puppy in, and that's not what a bath is. We're actually showering them, right? But with our inflamed skin, take a moment and recall when you were young and foolish and fell asleep by the pool in the summer and woke up with a nasty burn. You went into your normal warm shower and it was way too hot. So for our inflamed skin, we want to use cool water. It does not have to be cold, but when you feel the water and all you feel is wet, that's really the perfect temperature. That's going to help rehydrate that skin. Warm water will actually dehydrate the skin. And of course, if the skin is inflamed, it's just going to irritate it further. So we can add that in there. But, if we're talking about natural remedies for yeast, first we need to make sure it's yeast. Itchy pet. See your pet.
Now, Jenny and I can probably have an anecdote for you on this, because you think, you do it long enough, you're with enough dogs, one smells like wet tortilla, you think you can name it with your nose, but you can't. And as Jenny mentioned earlier, I get fooled on a daily basis at what, it's cytology, everything. So we do a lot of cytology, and it's because you can never guess. So yeah. True point, Jenny, to know that it's yeast. A lot of people assume their dog is yeast when they come into me, say it's been yeasty for years, and I'll do cytology and there hasn't been a yeast on the dog ever. So yes. You can't look at it with your eyes, unfortunately.
Yeah, and we're in referral practice, so we've even seen cases that have been on antibiotics, and it's refractory to those antibiotics. They've been on for weeks and weeks with no improvement. And we do cytology and find out it's yeast. Antibiotics don't work on fungus. And we can see the reverse as well, treating antifungals, thinking it's yeast when it's a bacterial infection. So the sooner you get to a vet, the better, All right.
Well,
sorry, go ahead.
I was going to say something about the cool to tepid water, which is really important, because if the skin's inflamed, the cool water almost by itself is a soothing, wonderful thing to do. You're going to wash off microorganisms. You're going to wash off some of those pollens. So if nothing else, a cool water bath is so helpful.
Yeah, and there have been a few studies now that have shown with our allergy dogs, who that's the biggest chunk of what we see every day, with our allergy dogs, bathing once a week as just a maintenance protocol does make a big difference for them.
Yeah.
So here's a question that we didn't get, but I have for you. How often is too often to bathe a dog?
So when I say that, I'm always talking about allergic dogs. And my answer refers to the study that you just talked about, which is that if an allergic patient is bathed up to once a week with the right shampoo for that dog, cool water to rehydrate the skin. In Alberta, I would add a conditioner and not a blow dryer. That can reduce drug requirement to control that dog's itch by up to 20 to 25%. Now, bathing with the wrong shampoo in the wrong way, I think creates ongoing irritation. So it depends on the dog. And then there was a study that you and I used to talk about, Jenny, and it was a PhD that the consensus of the paper was that the owner knew when to bathe the dog. When those dogs are greasy and smelly, it's often that the owner knows when, or the itch is coming up, the owner can titrate. And some months of the year, they may need to bathe weekly, and some months of the year, they may be able to get away with monthly. So I really try and have it titrated to the dog, to the owner, to their capacity, to their relationship with their groomer, and try and make it fit in without being a lifestyle burden. But correct, week. Yeah.
Yeah, that's a really big point that you just touched on too, is it can be an emotional burden to have an itchy animal. It can be a financial burden as well. We have all these plans that we know are going to be helpful, but if one, they can't be executed, it's not going to be helpful. Or if two, the family can't now eat because they bought the expensive medication or shampoo or whatever, that's not so helpful either. So always working with our owners to find out what's going to work in their world, because there are some critters you just can't bathe, or I don't know why, but all Newfoundlands are owned by little tiny old women. I don't know why, but they cannot get them in the tub. So don't set everybody up for failure, And
Yeah.
another thing I realized we didn't mention, but we probably should for our grooming group here, is if you have an animal that comes in with skin issues, don't put a hot air dryer on them. Just use the cold setting, please, because again, it's just going to make that skin worse overall. Okay, here's our next question. And I think I know the answer to this.
Lump and growth identification. This is like sniffing out the yeast and the bacteria. If you see a lump, see your vet. The lumps are hard, joking aside. You can have, again, depending on the owner, you can sometimes have a dog with 10 lumps, and it can be really hard to know that we have to test every single one. It can be financially draining to do so. So again, you guys see the lumps. We've got lumps that we talk about look like warts, which of course warts would only be papillomavirus itself. Doesn't happen in older dogs, but we've got little benign hair follicle tumors lots of times, but there's zero predicting what a lump is without testing it. And as frustrating as that can be, when the odds of Russian roulette of one lump being life-threatening and the other lumps being completely benign, you have to really investigate it.
Yeah, absolutely. There's a term that we use in vet medicine, and it is mast cells are the great pretenders. Mast cell tumor is big trouble, and it can look virtually like anything. So you never truly know what that lump or bump is until you remove it and submit the whole chunk for histopathology. Yes, we often will do fine needle aspirates, but that is sucking out a few cells from one teeny tiny spot in a tumor and hoping that it's representative of what that tumor is. So it's a good first step, but is it truly diagnostic? Well, if you see those mast cells on that sample, yes, I would say it is. But if it just comes back as fat cells, which sometimes happens, maybe it is a lipoma, just a fatty tumor, or maybe your pet's a little insulated and you didn't quite get to the right spot of that tumor.
And it's even tempting in our job, because same owners, to do a quick aspirate and look at it and think, well, it doesn't look too sinister, but we've all been caught. And it's so important that you make the diagnosis on mast cell tumors, lots of different kinds of tumors that are not benign, but that feel like little lumpy masses. So the best thing to do, and again, groomers could be part of this, is getting a body map for that dog and making sure people are mapping and tracking the lumps, and we know which one is which.
Yeah, and especially if those bumps are bothering that pet. So itchy pet, see your vet. Okay. This one you will know way more about, because here in Southern Ontario, you're right, we don't use many conditioners. So maybe this is someone from my neck of the woods.
Yeah, so I never see any vet prescribed conditioners. Why not? Now, the interesting thing about dermatology and the art of it is that you would have different dermatologists have different opinions. So take that into account. I usually use a medicated shampoo. I like a medicated shampoo because I feel that the medicated shampoo can sit on the skin for 5 minutes contact time before it's rinsed. It can do its job. We can massage it in gently. And I don't use a medicated conditioner because I let my shampoo do my work. And then I just use any aloe and oatmeal conditioner, to be honest. There's veterinary ones I carry. They are over the counter. They're not prescription. There's over the counter ones that my owners think works well. And I just aim for aloe and oatmeal, as long as the dog doesn't have a hypersensitivity to oatmeal, which does happen. Yes. But I don't use medicated conditioners. So that's why you would see it. There are a couple of spray-on conditioners that are medicated. There's a conditioner that works very well against bacteria, as an example. And I do use that as a spray-on, but not as a conditioner post-bathing. Yeah. So conditioners, again, it depends where you live in the country, but if you're bathing that pet, especially as a groomer, through the summertime, you're not seeing a lot of dry skin, but once the fall comes, the skin's getting drier, just adding on a conditioner would be would be perfect. And again, you're probably doing that, and I'm guessing they have emollients or aloe and oatmeal. That's what you want. You want some hydration, particularly after using a medicated shampoo. Yeah.
Okay. I'm gonna move on to this guy.
Oh, what's contagious? Excellent question.
We like the contagious ones.
Yeah, we love contagious ones because it gives us a hint if more than one dog is itchy. Now I should tell a story. When I first moved back to Calgary, I had this wonderful groomer, but I didn't know them personally. I went every 6 months. I had a border collie, so they would bathe her and make her look beautiful. One day they phoned me and said, "Are you sitting down?" And I said, "No." And they said, "Well, we think you should sit down." I'd never told them what I did for a living. So I sat down and they said, "We've got to tell you your dog has lice." And I burst out into hysterical laughter and told them what I did for a living. So in Calgary, there's a lot of lice, is
Yes.
what I'm going to say. And lice out here is what I would say is the most contagious. I mean, a dog walks past another dog with lice and they get it. I love it that it's species specific. So the lice on a dog is staying on a dog. But I would say lice is contagious. Fleas, of course, are contagious. Sarcoptic mange is contagious.
And zoonotic, so people can get it too.
Yeah, so sarcoptes, which a lot of people call mange, is contagious. Now I wouldn't, and then ringworm would be my last contagion. We talk about another mite that some people call mange, which we call demodicosis or demodex, and that is a mite, but it's not a contagious mite in dogs. Yeah, so I think we covered them.
Yeah, there is a flavor in cats. I don't know how many cats go to the groomers, but there is a contagious flavor of Demodex in cats. But not something often seen. But you know what? You never know. So I'm going to say, itchy pets,
see your vet.
vet.
And actually, I threw out ear mites.
Oh, yeah. Yeah, that's a big one too. Yeah. And then I also had on my little notes viruses. So that papilloma virus. You know, if you see that coming in, that's a sign that someone's immune system isn't working quite right. And please don't have a community water bowl that everybody drinks out of, because that's a great way to spread that one.
Yeah. Yeah. So as a groomer, I think the two things that would be most contagious in your clinic would be lice, papillomavirus, and sarcoptic mange. Well, and ringworm. Yeah.
Yeah. Yeah. All righty. Moving right along here.
What type of support tools would you find helpful to communicate normal, healthy skin and coat to pet parents?
And we have created an entire slew of stuff for you guys. You asked to have some pamphlets with graphics on them. You asked to have diagrams and handouts. I don't think we did any diagrams, but we got a ton of information on that CAVD website.
There's infographics, if that counts as a diagram.
Yes. Yeah, I would go with that. You guys asked for YouTube links. We have those on there for you. So please troll around, because I think you'll be happy with what we put together. Again, wanted to have some handouts. We do have handouts, but they're, I think, quick and easy, and we've turned a lot of them into video. That long anymore, I don't know. And again, more pamphlets or visual aids on a lot of people were saying they wanted to know normal versus abnormal. And we've got like a collection of images on there too, pointing out what is abnormal, which I think is helpful. Hopefully that's helpful for you guys. And then we're going to totally switch the topic here.
Oh, yeah, this is a left change. More information on better diets besides kibble. And that's a hard one.
It's a loaded gun, isn't it?
It's a loaded gun. And there's a lot of emotion behind food. There's a lot of opinion behind food. And there's a lot of fact behind food as well. Depends where you're going to get your resources. As an example, I would tell anyone that a high quality kibble is the best way we can feed our dog in 2023. while fresh prepared food seems like the logical thing for humans, getting away from the processing and the dusty, preservative type foods, we know as humans that's an important thing to do. We want fresh food. The challenge is that in veterinary medicine, it's very hard to make fresh food and make it as perfect of a meal as a high quality kibble. Now, high quality kibble has a definition, and in Canada, I think in the United States, they said there was more than 4,000 different types of dog food when you walk into a pet store. So it's very overwhelming
Oh,
for
yeah.
owners. Very little regulation about whether the marketing is consistent with the food inside. So this is a moving target. The healthiest meal you can feed your dog is a high quality kibble, at the moment, in my opinion. Fresh prepared foods lack the perfect balancing in vitamins and minerals to the potential of creating disease, really. If
Yeah.
we don't have perfect calcium and phosphorus and magnesium ratio, I'm not a nutritionist. When we have an imperfect balanced diet, we end up with kidney disease, liver disease, bone disease.
And those
And
needs change with time as well.
exactly.
So what
Yeah.
you fed a young 1-year-old dog is not going to be appropriate for
No.
feeding a geriatric older dog.
Yeah. So I could talk, Jenny and I could talk about food for 6 hours. It's a hot topic. And right now the perfect meal is in a high quality kibble. And whether or not we can transform that into a fresh prepared meal, and still feed the world population of humans it's a hot topic. Yeah.
Yeah. And I'm going to throw a little something perhaps controversial in there too. I imagine this food question comes from someone who is thinking along the lines of a food allergy and feeding raw food. And in fact, so with our food allergy guys, the usual suspect is the animal protein in the diet. Never say never. My dog has trouble with corn. There's always exceptions. But the vast majority of our patients, it's the animal protein in that diet. And there's little parts to that protein, microscopic molecular parts to that protein. And when it's cooked or processed, the chance of hitting those parts is dramatically less than having a raw, intact, full protein. So if anything, a raw diet, if it contains the protein that that animal has issues with, you're going to get a more profound reaction to that raw diet versus perhaps the same protein that's been cooked in a kibble or a processed diet. So just throwing it out there.
And I think the good news is there's advancements in that allergology we just talked about, where we're looking at molecular diagnostics, and I do believe we're on the cusp of being able to name some of these microproteins and understand it on a deeper level. So yeah, food is a toughie, but Jenny's correct. When we're talking about the protein, it's hiding it from the dog that we want to do, or not actually avoiding it. Yeah.
Yeah. Yeah. So, and figuring out a diet for an allergic animal is no small feat. So one more time, in case you didn't catch this already.
It's your pet, see your vet.
Those are the best words you can tell your clients. It's an itchy pet. They said, see your vet.
Yeah.
So other things you guys were asking for.
It would be helpful to have a pamphlet with pictures / examples of common skin and coat issues, normal versus not normal, and when to see your vet.
Yeah. So troll around that website.
Videos that I can link to my website and social media. Yeah. So I don't know what that looks like, but I don't see why someone couldn't link the CAVD to their.
I agree.
Yeah.
I think that's totally doable. And then photos we've got on there as well.
Sheets. That goes back to, we can, it's so wonderful being dermatologists because you can see the problem on the skin. But to Jenny's point, a lot of the problems look the same, but they're very different infections. So that's where we use our cytology and our microscope and make a diagnosis before we know what the treatment recommendation is.
Yeah, the takeaway for you guys is a lot of things from benign to very, very serious can present the same. And in veterinary dermatology, our primary presenting complaint is pruritus, which means itching. So they all come in itchy, the poor little critters.
Yeah.
Yeah. So guess what, Becky?
Oh!
Yay!
Yay. Well, we were very excited to be able to have this first year of having some groomers in our team. And I'm hoping that you guys will have gotten something out of this and that we can continue to forge a partnership.
Yeah, absolutely. I think we're just at the start, and don't underestimate how much your clients lean on you, because I hear it every day. Well, my groomer said this. So, you do play an important role.
Yeah, that's right.
So one more time.
Itchy pet.
See your vet. Thanks so much for joining us, everyone.
Thank you, Jenny.
Bye-bye. Welcome. Thanks, Becky. Bye.